How is lymphoma relapse monitored after treatment? Imagine finishing treatment for lymphoma and wondering how doctors keep an eye out for it coming back. Monitoring for relapse is a careful process that combines several methods to catch any signs early. The first step is regular follow-up visits with your healthcare team. During these appointments, your doctor will check your overall health, ask about any new symptoms, and perform physical exams. Most relapses are first suspected based on new symptoms or physical signs rather than routine tests. That's why it's important to report any changes like swelling, unexplained weight loss, or night sweats promptly. Imaging studies are also used to monitor lymphoma, especially in the past. Techniques like positron emission tomography scans and computed tomography scans can show if the disease has returned. However, routine imaging in patients without symptoms is becoming less common. This is because frequent scans can expose patients to radiation, sometimes lead to false alarms, and may not actually improve overall survival. Now, doctors tend to reserve imaging for when symptoms or physical findings suggest relapse, or when early detection could change the treatment plan. Blood tests are another tool, but they have limitations. Common tests like blood counts and lactate dehydrogenase levels are not very reliable on their own. Elevated lactate dehydrogenase can indicate lymphoma activity but is not specific. Recently, scientists are exploring molecular blood tests that look for circulating tumor DNA. These tests can detect tiny amounts of lymphoma cells in the blood, sometimes before symptoms or imaging show anything. Studies suggest that monitoring circulating tumor DNA might predict relapse earlier, especially in certain types of lymphoma like large B-cell lymphoma treated with advanced therapies. While this technology is still being refined, it shows promise for future surveillance. Monitoring strategies are becoming more personalized. Patients with higher risk factors may have more frequent checkups and testing, while those at lower risk might have less intensive follow-up. The goal is to balance early detection of relapse with avoiding unnecessary tests and their potential harms. Supportive care and patient education are also key. Patients are encouraged to learn about signs of relapse and to stay in close contact with their healthcare team. This ongoing communication helps catch any issues early and ensures prompt evaluation. In summary, after lymphoma treatment, doctors use a combination of regular clinical exams, symptom awareness, selective imaging, and emerging blood tests to monitor for relapse. Routine scans and blood tests are not always necessary if there are no symptoms. The trend is toward personalized care that uses new technologies like circulating tumor DNA analysis to catch relapse early while minimizing unnecessary procedures. Always remember, staying connected with your medical team and reporting any concerns quickly is the best way to support your ongoing health and well-being.